For many people, visiting a retail clinic like the Minute Clinic inside this pharmacy has become a routine part of life. If your child has a very sore throat and it's 7 o'clock at night, the convenience of popping into a drugstore for a quick strep test and an antibiotic can be irresistible. The clinics take a variety of insurance plans, and prices for services are clearly posted, so patients paying out of pocket will know exactly how much a visit is going to cost. Anna Federico, District Manager of Operations for the Jersey North Division of Minute Clinics, said the clinics provide patients with an easy way to get treatment for minor acute ailments when their physician is not available.
At Minute Clinic, we offer services for the more common family illnesses and ailments that come up, and we provide convenient access to it, such as sinusitis, ear infections, strep throat, bronchitis, contact dermatitis, which would be like a poison ivy rash. So we provide most of those common ailments that sometimes you just don't have time to take yourself out of work and get to the doctor, or it's evening, or it's weekends and your physician's office isn't open at the time. So we try to provide increased access and a little more convenience for them.
Retail clinics started appearing on the scene a few years ago, and there are now more than 1,200 operating in 32 states, according to the Convenient Care Association, a trade group for the clinics. But now there are other reasons besides a sore throat or a bad cold to visit clinics like this one. Federico said that in the last few weeks, clinics in her area have begun providing monitoring and screening services for a variety of chronic conditions.
We've begun monitoring for continued illnesses, such as diabetes. We also do preventative or helping people with smoking cessation. We will do obesity evaluations. We will also do hypertension screenings and diabetes screenings and cholesterol screenings.
Federico said the monitoring service is meant to help patients manage their chronic illnesses in between physician visits, but it is not meant to replace the physician.
We will not be managing patients with these ongoing conditions, but they can come to us in between, or if they're having a hard time getting their physician, or many patients who are underserved, they may have insurance but don't have access to a physician because in their area that no one's taking any patients yet. So they can come to us and at least get some monitoring, and then we can help them get into a physician. Because if you come here and you don't have a primary care doctor, we print out a local list of physicians that are accepting patients, and we will help you get hooked up with a physician. Because we believe everybody should have a medical home and that it should not be Minute Clinic. We are an adjunct to your health care. We don't want to replace your medical home.
Physicians have generally accepted the clinic's presence, she said.
In many areas, they're very appreciative of the fact that, when their hours are closed, patients can come to us, and within 24 hours, they either receive a fax, email, or it gets mailed to them, depending on what their technology is in the office. So they know they will get a report of what has occurred here, what we found, and what we treated with. I've heard, don't know it personally myself, that some physicians will say, we're going to be closed at 5 o'clock. If you have any issues, you can go to Minute Clinic and they can refer you, which we do. If it's more severe than something that we can take care of, we will definitely refer you to the ER, urgent care, and if need be, put a call out to them also so they know that you're coming.
Federico said that although she didn't know how much more the clinics would expand into chronic disease care, she did hope that the clinics will become known for more than just acute illnesses.
We hope to provide a year-round service to everybody and not, just be known as coming to us for the flu shot, that we provide a wider range of, limited but a wider range of services that people can come to us for.
For MedPage Today, I'm Joyce Frieden.